Hey guys, welcome or welcome back to the YouTube channel. If you're new here, my name is Vikinjuguna, and today, as promised, I'm going to tell you like the symptoms and the signs of PCOS as promised in my previous video on PCOS. So if you haven't watched it, I'll link it up for you over here. And without much talking, let me get straight into the video. So I'm going to read them from my laptop, so you'll see me looking on this side most of the time, but yeah. So I'm sure when I was doing that video, I spelled out what PCOS actually means, which is Polycystic Ovary Syndrome. It is caused by it is a hormonal disorder common among women of reproductive age. Yeah, so it is a hormonal disorder that causes someone to have cysts on their ovary. Yeah, that's the definition I read from Google, and this is another site I'm reading from. So let me read the exact sentence actually. It says the ovaries may develop numerous small collections of fluids called follicles, which are called cysts, and fail to regularly release eggs. So for people with PCOS, like every month you have to release eggs, right? So for us, we don't have the ability to release eggs on a monthly basis because the small collection of fluid prevent us from doing that, right? So that's what will actually cause irregular periods. So like there are a lot of symptoms for PCOS, but I'll just point out like the main symptoms for PCOS. So the first one is irregular periods. Irregular in the sense of some are prolonged, some are infrequent, and then just irregular. So for example, you might have fewer 9 periods an year, or even 5 or even 4. But for me, I normally have between 4 to 8 periods an year. That's the best. If I can remember well, I have 4 to 8 periods an year, which is normal because a normal person should have all 12 periods in a year, right? So some are prolonged, like when I was telling you I can stay for like 4 months without seeing them, and then boom, they'll come and stay for like 6 or 7 days, of which if I'm getting like a normal period, it's only like 5 days. So sometimes they stay 6, 7 days, or even 9 sometimes. But I don't think they've ever reached past 9. Yeah. And the second symptom of PCOS is excess androgen. Elevated level of male hormones may result in physical signs such as excess facial and body hair. When I was telling you I was growing hairs over here, that's like I have excess androgen in my body because of the hormonal imbalance. So we'll have a lot of male hormones within our bodies, which sometimes may become physical. So we normally have a lot of body hair. When I was telling you I was hairy, that's what I meant. I'm very hairy. I have hair on my face, and for some people, they have severe acne. For me, I'm just thanking God I didn't have. But there was a point when I was in class 7, if I'm not wrong, I had acne like what they were all over my forehead. But nowadays, I normally get them on this side of my face. It's just that I have makeup. And I didn't feel like removing it because of doing a few TikToks here and there. So I was just like, no, I'm not doing that today. So I normally develop acne on one side. On one side of my face, like something has entered my eye. I don't know how the fuck it is. And it's so disturbing. Yeah. I normally have like acne around my chin and my right cheek most of the time, but occasionally, yeah. But I cannot say I suffer from severe acne. I guess I'm just lucky. Yeah. And the third symptom is polycystic ovaries, which your ovaries may be enlarged and contain follicles that surround the eggs. As a result, the ovaries may fail to function regularly. I think I look for images which can compare like a normal ovary and an enlarged one. I left my scans at home, and I'm in school, so I can't really show you my own scans. But I wish I had them. So yeah, my hair looks crusty, but you all have to forgive me. And yeah, I'll look for images which can compare like a normal ovary and a large ovary. But mine is enlarged and has two small cysts around them, which are like, I remember they're like 2 millimeters thick. So they're not big, but they're small, mini cysts around my ovary. So went to see a doctor. You only see a doctor when you're concerned about your periods and if you're experiencing infertility or if you have excess signs of androgen. For me, what pushed me to go to hospital was my prolonged black periods and my hairs on my face. That's what really pushed me to go to hospital. And of course, I was gaining weight. That was what was pushing me to go to hospital. Yeah, but there's some people who actually experience baldness. I'm just lucky, I was blessed with good hair. Yeah. So there are many causes of PCOS. Number one is excess insulin. Yeah, there are people who are, we have excessive insulin, but let me read it out for you guys. Insulin is the hormone produced in the pancreas that allows cells to use sugar, your body primary energy supply. If your cells become resistant to the action of insulin, then your blood sugar levels can rise and your body might produce more insulin. Excess insulin might increase androgen production, causing difficulty with ovulation. I have excess insulin, but my sugar levels were somehow low. I don't know how my doctor explained it to that, but that's why I have like, I was telling you guys, like, people have beards. Like you're a lady and you have beard, but for me they're just little hairs which grow over here. So my blood sugar is not as high, but at the same time I have just a bit of excess insulin. That's why I have excess androgen in my body. So the second cause is low-grade inflammation. This term is used to describe white blood cells production of substance to fight infection. Research has shown that women with PCOS have a type of low-grade inflammation that stimulates polycystic ovaries to produce androgens, which can lead to heart and blood vessel problems. I really don't know about this because I wasn't even told that by my gyna, but I really don't know much about it, but I guess that's the explanation. So I cannot explain to you something that I'm not even sure about. So yeah, there is heredity. Research suggests that certain genes might be linked to PCOS. Well, this is a bit a lot, but yeah, I think mine is inherited probably. My mom's side of my family, yeah, there are several cases of PCOS, so yeah, I guess I got mine from them. Excess androgen is ovaries produce abnormally high levels of androgen, resulting to hirsutism and acne. Yeah, as I said, I have excess androgen. It's pretty much the same explanation to excess insulin. So there are, of course, there are complications that come with PCOS, which are quite many. When I tell you PCOS is not like a small thing, it's not. There are quite many. So let me just go like the first one, the immediate complication of PCOS is infertility. Remember, one, you're not having your periods on a monthly basis. So that may cause you, when you're trying to get a baby, for those who are trying to get a baby, it might be hard for you to actually conceive because you're not sure when you're ovulating. For one, that's the main thing. You will never be sure when you're ovulating because your periods can just say you're not coming, or either we will come too soon, or either you will never see us. It's that type of vibe we get with PCOS. So yeah, you never know when you're ovulating, so you cannot plan ahead. But unless you're taking like supplements and all that which can help balance your hormones, if you're not, then I mean, it's just for you and whoever you're trying to get a baby with to try your luck until you get pregnant. That's one thing with infertility. But there are people who get pregnant when they have PCOS, but it's a struggle because, yeah, as I said, you don't know when you're ovulating, so you cannot plan with your hubby or boyfriend when you're going to get pregnant. Yeah, but there are people who get pregnant through IVF and all that. So having PCOS doesn't limit you to getting pregnant. It's just that you're at a higher risk of being infertile. The second complication is I'm trying to pronounce this word. Gestational diabetes or pregnancy-induced high blood pressure. As I said, when I was told by my gyna I'm at a higher risk of developing diabetes or high blood pressure. I think that's hypertension, I'm not sure. But also my aunt told me something about having hypertension. Yeah, PCOS can really tamper with your health, like so bad to a point of you developing diabetes or high blood pressure, which is pregnancy induced. So yeah, when you get for people like us with PCOS, being pregnant it's really putting your life at risk. I'm not sure, I don't want to say it that way, but it is what it is. So yeah, when it's a higher risk, when you get pregnant, I guess we're putting our lives at risk, but I think we are strong enough to do that because I personally want a good future for myself. So I'm praying to the Almighty that I will not. Inshallah. The third complication is miscarriage or premature birth. I don't know how to explain this exactly because I haven't ever gotten pregnant. So, but I know it's one thing that people with PCOS will have to encounter at some point of their lives. So yeah, because of the hormones, we don't have enough hormones, or our hormones are just fucked up. I think that's the best explanation I can give for that. The fourth complication, an alcoholic steatohepatitis. Wow, a severe liver inflammation caused by fat accumulation in the liver. Yes, weight gain. Girl, we will eat healthy, we will do everything, but your body will just gain weight. And when you gain weight, of course, your body will store fat, and it can store fat around the liver, around the heart, around the whatever, stomach. It will just decide to store the fat anywhere. So you might develop this non-alcoholic steatohepatitis, the liver inflammation, because we tend to store so much weight. I do not know why. I really wish there was another way to storing weight, like getting it out of our bodies, but well, that's the best explanation I can give. The fifth one is metabolic syndrome, a cluster of conditions including high blood pressure, high blood sugar, and abnormal cholesterol or I will leave that one out, that significantly increase your risk of cardiovascular disease. I can't explain that really because I don't know what it means. But yeah, I really think it's just about weight. I'm not sure, but I don't want to butcher that explanation. I think I'll link this site because I don't want to butcher anything. So yeah, you can go and do your own research. The fifth complication is type 2 diabetes or pre-diabetes. I think I explained it together with the one for gestational diabetes. Yeah, it's pretty much the same thing. Sleep apnea. What the hell is this? Let me research. What the hell is sleep apnea? It's a potentially serious sleep disorder which breathing repeatedly stops and starts if you snore loudly and feel tired. Wow, I've never known about this. Guy, when I was in high school, when I was in high school, there was a chick was sleeping beside me. She was telling me that times at night I'll breathe heavily. Like nothing is being triggered. Come on, this is what it is. Okay. Sleep apnea. Wow. If you snore loudly and feel tired even after a full night, because honestly I do feel tired when I wake up. That's one thing. I won't even lie to you. I am one tired person when I wake up. Yeah. But I don't think like it's that advanced. Love. Out snoring. The times I stop breathing, which will be reported by another person because I'll breathe loudly and then I just go silent after some time. Wow, at morning headache, difficulty staying asleep, excessive daytime sleepiness, difficulty paying attention. Wow, I've never known about this. Damn, okay. I'm also doing that for myself. This is so sad. I just thought it was something else, not PCOS. It's okay. It's okay. It's okay. I think I'm in shock and I feel like crying, but it's okay. The what number is this? I think this 8th one. It's depression, anxiety, and eating disorders. That one I can attest to. I eat before, like I started. If you don't follow me on Instagram, like I normally post on my stories how I eat because I'm trying to lose this PCOS weight. Well, so I used to eat a lot, not a lot, but I will eat a lot of starch. That's the best way I want to put it, because I'll have cravings. Kwanza chipo, I'll have cravings for chips, like anything just cooked with mafuta. I will have cravings for it. Depression and anxiety, I think I've had the worst of it all. But I think I have more anxiety than depression. Depression really is, I feel like it's triggered with something else. But I am more anxious than being depressed. And eating disorders, yeah. Sometimes I feel like eating a lot. Sometimes I don't even have appetite. Like of late, I've not had appetite for like 2 days straight now. I don't know. I've not even eaten from morning. But well, another complication is abdominal uterine bleeding. I'm just happy I don't have that, but there are people who pee blood, and it's not periods, they pee blood. So yeah, that's another complication. And the last one, cancer of the uterine lining, endometrial cancer. Actually, apart from endometrial, you can actually develop ovarian cancer. Kind of, yeah. I think that's when PCOS really reaches its max, you can have cancer. That shit scares me to death. But no, we are not claiming that. So also another one is obesity is associated with PCOS and can worsen complication of the disorder. One thing, when I went to my girl, she told me you have to lose weight as immediately as possible. Although it sounds as big as possible, I was already obese. So this was putting me at a very high risk of developing like all these complications that I've read over here. So that's the first thing I should do. Like, that's why I feel like, although sometimes you're just told to lose weight, I think this losing weight really prevents us from developing all these things. That after you've lost all the weight, that's when you can start you can pinpoint what you want to correct, you as in specifically. But once you're obese, you can't even change. You have to change your weight first before you start treating anything else. So yeah, I guess that's it for today. I want to like expound on mental health related with PCOS type of thing, because that's a whole topic on itself. But I want to share with you guys like the symptoms and all that. If you feel like you're having any other symptoms that I've not mentioned, you can comment down below. But for me, I've experienced like 90% of those symptoms that I've read. So yeah, I hope it has helped someone or a few people. I hope it has helped someone. Like, I think like, I don't know even what I'm saying, but yeah, I hope it has helped someone, and I can't wait to see you guys next time. So bye.